Police officers often get dedicated training for the various scenarios they'll encounter on the job. More recently, local police are getting specialized training when it comes to helping people experiencing a mental health crisis. The state of Arkansas has made progress in the last couple of years to provide these resources and training, not only for officers, but also the people they serve. 5 News reporter Ian Taylor outlines what measures are in place for our officers to be more effective in these situations.
A true crisis occurs when someone is engaging in conduct or is not able to conform the behavior to keeping themselves safe or threatening someone else.
Frequently, law enforcement encounters someone in physical danger or someone experiencing a mental health crisis. Work is still underway to correct misconceptions about mental health for Arkansans and Americans alike. Megan Bierman is a therapist at Emerging Hope Therapy. She says she's working through some of these misconceptions.
There's so many stigmas and labels that are put on mental health that I think that a lot of times that's what keeps people from even reaching out and seeking help.
According to the leading community-based nonprofit Mental Health America, Arkansas has ranked in the bottom half of year-over-year trends when it comes to individuals with mental illness and access to care or resources. In 2017, Arkansas lawmakers signed Act 423 to correct this trend. The law mandates specialized law enforcement training across our state when it comes to responding to situations involving someone in a mental health crisis. It also provides a designated location to send someone for treatment options.
Our main goal was to decrease the amount of mental health clients that end up in jail, not because they're criminals necessarily, but because their behavior has created a situation where there's nowhere else to take them.
With the passage of Act 423, the Arkansas Law Enforcement Training Academy, or ALETA, has diligently worked to increase officer training across the state with crisis intervention team training. Departments in Arkansas are encouraged to have at least 20% of officers who have gone through a minimum of 40 hours of training related to crisis intervention.
This class involves the mental health professionals and some law enforcement instruction to help guide the officers through the process of encountering and working with someone that's experiencing a mental health crisis.
I really feel like law enforcement is taking those steps to better educate themselves.
In Fort Smith, the police department became the first department in the state to implement a crisis intervention unit. It's a team of officers who have undergone the training and are specialized to handle mental health crisis situations.
A large portion of our department, and on our way to 100%, but a large portion of our department are trained in crisis intervention recognition and training and how to de-escalate such situations. Our crisis intervention unit are experts at that.
As a department, Fort Smith is taking ALETA crisis intervention training beyond the classroom, with new ways to put themselves into real-life situations in a safe setting through virtual reality.
We have a board of directors that recognize the need to properly address mental health crisis in the city and is able to give us funding to buy equipment for us to better address these needs.
The state has taken similar steps to address mental health through crisis stabilization units. These are clinics police can take someone to get help during a mental health crisis. They serve as an alternative to sending someone to jail or a hospital. On March 1st, 2018, the 5 West Crisis Stabilization Unit opened their doors and have helped serve Sebastian, Crawford, Logan, Scott, Polk, and Franklin counties. They have also helped pave the way in opening 3 other units around the state in Washington County, Pulaski County, and Craighead County. These units are resources, and while they offer law enforcement another option for people having a mental health crisis, it's not up to any officer to determine who goes to these centers.
It is voluntary. So when you give someone a choice, they already are making a commitment to their own recovery by choosing to come.
I will crawl with you, I will walk with you, and I will run with you, but I will not drag you, because it's up to them and the work that they're willing to put in.
Ian Taylor reporting right now on 5newsonline.com. We have a breakdown of where you can find those mental health resource centers known as crisis stabilization units. These are open to the public. We also have a full breakdown by the numbers of the impact they're serving our community since 2018.